Tapeworms. Tapeworms are a type of parasitic flatworm that live in the digestive tract of animals, including humans. They are called tapeworms because their bodies are long and flat like a tape or ribbon, and they can grow to be several meters in length. Tapeworms have a unique structure that allows them to attach themselves to the intestinal wall of their host and absorb nutrients from the host's digested food. They have a head, called a scolex, which has hooks or suckers that help them attach to the intestinal lining. Behind the scolex, there is a long, segmented body made up of individual segments called proglottids. Each proglottid contains male and female reproductive organs, so tapeworms are hermaphrodites. Hermaphroditism is a condition of having both male and female reproductive organs. Tapeworms can infect humans if we eat undercooked or raw meat that contains tapeworm larvae. Once inside the human body, the larvae develop into adult tapeworms that can live for years. How common is tapeworm infection in humans? The exact prevalence of tapeworm infection in humans is difficult to determine because many cases are asymptomatic and go undiagnosed. However, it is estimated that millions of people worldwide are affected by tapeworm infections each year. The incidence of tapeworm infection can vary widely depending on a number of factors, including geography, cultural practices, and hygiene and sanitation standards. For example, certain regions of the world where raw or undercooked meat is commonly consumed may have higher rates of tapeworm infection. Additionally, certain cultural practices, such as eating raw or lightly cooked fish, can also increase the risk of tapeworm infection. In general, tapeworm infections are more common in developing countries where sanitation and hygiene standards may be lower. However, cases of tapeworm infection do occur in developed countries as well, particularly in individuals who travel to endemic areas or consume imported foods. It's important to note that while tapeworm infections can be serious and cause a range of symptoms, many cases are mild or asymptomatic and can be effectively treated with medication. Practicing good food hygiene and sanitation practices, such as cooking meat thoroughly and washing hands regularly, can help reduce the risk of tapeworm infection. Additionally, routine deworming of pets can also help reduce the risk of tapeworm transmission. How do you get a tapeworm infection? Tapeworm infections in humans occur when a person ingests tapeworm larvae, which are the immature form of the tapeworm. There are several ways that a person can become infected with tapeworms. 1. Eating contaminated meat. Tapeworm larvae can be present in raw or undercooked meat, particularly beef, pork, and fish. If a person eats contaminated meat without cooking it properly, they may become infected with tapeworms. Contamination. 2. Consuming contaminated water or food. Tapeworm eggs can be present in contaminated water or food, particularly in areas with poor sanitation and hygiene standards. If a person ingests tapeworm eggs, they may become infected with tapeworms. 3. Poor hygiene. If a person comes into contact with tapeworm eggs or larvae, for example through contact with contaminated soil or animal feces, and does not practice good hygiene, they may become infected with tapeworms. 4. Travel. If a person travels to areas where tapeworm infection is more common, particularly in developing countries, they may be at increased risk of becoming infected with tapeworms. 5. Exposure to infected pets. Some types of tapeworms, such as the dog tapeworm and the cat tapeworm, can be transmitted to humans from infected pets. This can occur if a person accidentally ingests tapeworm eggs or larvae from contaminated pet feces or fur. It's important to note that not all types of tapeworms can infect humans, and the risk of infection can vary depending on factors such as geography, cultural practices, and hygiene and sanitation standards. Practicing good food hygiene and sanitation practices, such as cooking meat thoroughly and washing hands regularly, can help reduce the risk of tapeworm infection. Additionally, routine deworming of pets can also help reduce the risk of tapeworm transmission. What are the possible complications of tapeworm infection? Tapeworm infections can lead to a variety of complications, depending on the type of tapeworm and the severity of the infection. Some possible complications include: 1. Malnutrition. Intestinal tapeworms can compete with the host for nutrients, leading to malnutrition and associated health problems. 2. Blockages. In rare cases, tapeworms can form large masses in the intestines, leading to blockages that can cause abdominal pain, nausea, and vomiting. 3. Neurological problems. Invasive tapeworm infections, particularly those caused by the pork tapeworm, can lead to neurocysticercosis, a condition in which cysts form in the brain and other tissues. This can lead to seizures, headaches, and other neurological problems. 4. Organ damage. Invasive tapeworm infections can also lead to damage of the liver, lungs, and other organs. 5. Allergic reactions. In rare cases, people with tapeworm infections may experience allergic reactions to the larvae or eggs. It's important to note that many cases of tapeworm infection are mild or asymptomatic, and complications are relatively rare. However, it's still important to seek medical attention if you suspect that you have a tapeworm infection, particularly if you have traveled to an area where tapeworm infection is more common. Early diagnosis and treatment can help prevent complications and reduce the risk of transmission to others. What is tapeworm infection? Let us discuss both intestinal tapeworms and invasive tapeworm larval infection. Parasites. A tapeworm infection is a type of parasitic infection caused by tapeworms, which are long, flat worms that live in the digestive tract of humans and animals. There are two main types of tapeworm infections: intestinal tapeworm infections and invasive tapeworm larval infections. 1. Intestinal tapeworm infections occur when a person ingests tapeworm larvae, which can be found in raw or undercooked meat, fish, or poultry. Once ingested, the larvae travel to the small intestine, where they attach to the intestinal wall and grow into adult tapeworms. The adult tapeworms can then produce thousands of eggs, which are passed out of the body in the feces. Common types of intestinal tapeworms include the pork tapeworm, beef tapeworm, and fish tapeworm. Symptoms of an intestinal tapeworm infection may include abdominal pain, nausea, diarrhea, weight loss, and weakness. In some cases, people may not experience any symptoms at all. Diagnosis of intestinal tapeworm infections typically involves a stool examination, which can detect the presence of tapeworm eggs or segments in the feces. Treatment for intestinal tapeworm infections typically involves medication to kill the adult tapeworm, such as praziquantel or albendazole. 2. Invasive tapeworm larval infections occur when tapeworm larvae migrate to other parts of the body and form cysts, which can cause damage to the tissues and organs. This type of infection can occur with certain types of tapeworms, such as the pork tapeworm or the hydatid tapeworm. Invasive tapeworm larval infections can cause a range of symptoms depending on the location of the cysts. For example, a cyst in the liver may cause abdominal pain or jaundice, while a cyst in the brain may cause seizures or other neurological symptoms. Diagnosis of invasive tapeworm larval infections typically involves a combination of imaging studies, such as X-rays, CT scans, or MRI, and blood tests to detect antibodies against the tapeworm larvae. Treatment for invasive tapeworm larval infections typically involves medication to kill the tapeworm cysts, which may be combined with surgical removal of the cysts in more severe cases. Overall, tapeworm infections can be a serious health concern, especially if left untreated. If you suspect that you may have a tapeworm infection, it's important to seek medical attention and follow the advice of your healthcare provider. Symptoms of tapeworm infestation. The symptoms of tapeworm infestation can vary depending on the type of tapeworm and the severity of the infection. In some cases, people may have no symptoms at all, while in others, the symptoms can be quite severe. Here are some of the common symptoms of tapeworm infestation. 1. Abdominal pain. People with a tapeworm infection may experience abdominal pain or discomfort, which can range from mild to severe. 2. Nausea and vomiting. Some people with a tapeworm infection may experience nausea and vomiting, especially if the infection is causing inflammation in the intestinal lining. 3. Diarrhea. Diarrhea is another common symptom of tapeworm infection, which can be accompanied by bloating, gas, and cramps. 4. Weight loss. Tapeworms can cause weight loss by consuming nutrients that the host would otherwise absorb. In some cases, people may experience significant weight loss even if they continue to eat normally. 5. Nutritional deficiencies. Tapeworms can cause nutritional deficiencies by consuming vitamins and minerals that the host needs to maintain their health. This can lead to symptoms like anemia, weakness, and fatigue. 6. Allergic reactions. Some people may experience an allergic reaction to tapeworms, which can cause symptoms like itching, hives, and swelling. 7. Worm segments in stool. In some cases, people may notice tapeworm segments in their stool, which can look like small, white or yellow pieces of rice. These segments contain tapeworm eggs and can be a sign of a tapeworm infection. 8. Other symptoms. Depending on the type of tapeworm and the severity of the infection, other symptoms may include fever, muscle aches, and seizures. That being said, in rare cases, tapeworm infestation can lead to complications that may affect other parts of the body, such as the liver, lungs, or brain. For example, if tapeworm larvae migrate to the brain, they can cause a condition called neurocysticercosis, which can lead to seizures, headaches, and neurological deficits. It's important to note that some people with a tapeworm infection may not have any symptoms at all, especially if the infection is mild. However, even if you're not experiencing symptoms, it's important to seek medical attention. If you suspect that you may have a tapeworm infection, as untreated infections can lead to serious complications. Types of tapeworms. There are several different types of tapeworms, each with its own unique characteristics, life cycle, and potential for causing disease in humans and animals. Here's a brief overview of the most common types of tapeworms. 1. Beef tapeworm, Taenia saginata. This is one of the most common tapeworms found in humans, and it is transmitted by eating undercooked beef that contains tapeworm larvae. The adult tapeworm can grow up to 10 meters in length and can live for several years in the human intestine. Symptoms of beef tapeworm infection can include abdominal pain, diarrhea, and weight loss. 2. Pork tapeworm, Taenia solium. This tapeworm is transmitted by eating undercooked pork that contains tapeworm larvae. Like the beef tapeworm, the adult pork tapeworm can grow up to 10 meters in length and can live for several years in the human intestine. However, pork tapeworms can also cause a potentially fatal condition called neurocysticercosis, in which the tapeworm larvae migrate to the brain and cause seizures, headaches, and neurological deficits. 3. Fish tapeworm, Diphyllobothrium lautum. This tapeworm is transmitted by eating raw or undercooked freshwater fish that contains tapeworm larvae. The adult fish tapeworm can grow up to 10 meters in length and can live for several years in the human intestine. Symptoms of fish tapeworm infection can include abdominal pain, diarrhea, and weight loss. 4. Dog tapeworm, Dipallidium caninum. This tapeworm is transmitted by accidentally swallowing infected fleas. The adult dog tapeworm can grow up to 50 centimeters in length and can live for several months in the human intestine. Symptoms of dog tapeworm infection are usually mild and can include abdominal pain, nausea, and diarrhea. 5. Hydatid tapeworm, Echinococcus granulosus. This tapeworm is transmitted by contact with infected animals, usually dogs or livestock. The adult hydatid tapeworm is very small and lives in the intestines of dogs, but its larvae can form cysts in the liver, lungs, or other organs of humans and other animals. These cysts can cause a range of symptoms, from mild discomfort to life-threatening complications. 6. Hymenelepis nana. This is the smallest tapeworm found in humans, measuring only a few millimeters in length. It is transmitted by ingesting food or water contaminated with tapeworm eggs. Symptoms of Hymenelopiasis infection can include abdominal pain, diarrhea, and weight loss. It's important to note that many people with tapeworm infections may not have any symptoms at all, especially if the infection is mild. However, untreated tapeworm infections can lead to serious complications. So it's important to seek medical attention if you suspect that you may have been infected with a tapeworm. How different tapeworms cause more infestations in different geographical locations. The distribution of tapeworms is largely determined by the prevalence of their intermediate hosts, which are the animals that carry the larvae of the tapeworms. The intermediate hosts can vary depending on the tapeworm species, and this can lead to differences in the geographic distribution of the tapeworms. For example, the beef tapeworm, Cania saginata, is most commonly found in regions where cattle are raised and consumed, such as in South America, Africa, and Asia. In these areas, the tapeworm can easily be transmitted to humans who eat undercooked or raw beef, which can contain tapeworm larvae. Similarly, the pork tapeworm, Taenia solium, is most commonly found in regions where pigs are raised and consumed, such as in Southeast Asia, Latin America, and Sub-Saharan Africa. In these areas, the tapeworm can easily be transmitted to humans who eat undercooked or raw pork, which can contain tapeworm larvae. Additionally, the pork tapeworm can also be transmitted from person to person through poor sanitation practices, which can lead to the formation of cysts in various organs of the body, including the brain. The fish tapeworm, Diphyllobothrium lautum, is most commonly found in regions where people consume raw or undercooked freshwater fish, such as in parts of Europe, Asia, and North America. The tapeworm larvae are typically found in the flesh of the fish and can be transmitted to humans who eat infected fish. The dog tapeworm, Dipylidium caninum, is most commonly found in areas where dogs are present. And the transmission of the tapeworm to humans typically occurs when a person accidentally ingests infected fleas. Poor sanitation. This type of tapeworm infestation is more common in areas with poor sanitation and hygiene practices. Overall, the distribution of tapeworms is largely determined by factors such as the prevalence of their intermediate hosts, the consumption of raw or undercooked food, and poor sanitation practices. Understanding the geographic distribution of tapeworms can help public health officials develop effective strategies for prevention and control of these infections. How tapeworms are diagnosed. Diagnosing a tapeworm infection typically involves a combination of clinical evaluation, medical history, and laboratory testing. Here are some common methods used to diagnose tapeworm infections. Stool examination. A stool sample can be examined under a microscope to look for the presence of tapeworm eggs or segments. This is typically the first-line diagnostic method for many types of tapeworm infections, including beef, pork, fish, and dog tapeworms. Imaging studies such as X-rays, ultrasound, or MRI may be used to look for signs of cysts or other abnormalities in the organs of the body that can be caused by certain types of tapeworm infections, such as the hydrid tapeworm. Blood tests. Blood tests can be used to detect antibodies against certain types of tapeworms, such as the pork tapeworm, which can help confirm the diagnosis. Endoscopy. Endoscopy is a procedure in which a thin, flexible tube with a camera on the end is inserted into the digestive tract to visualize any abnormalities, including the presence of tapeworms. It's important to note that tapeworm infections can sometimes be difficult to diagnose, especially if there are no obvious symptoms or if the infection is in its early stages. In some cases, a combination of several diagnostic methods may be necessary to accurately identify the presence of a tapeworm infection. What is the prognosis and prevention methods for tapeworm infestation? The prognosis for tapeworm infections depends on several factors, including the type of tapeworm, the severity of the infection, and the presence of any complications. In general, tapeworm infections are treatable with medication, and most people recover fully with proper treatment. Prevention methods for tapeworm infestation include 1. Proper food handling. Cook all meat, fish, and poultry thoroughly to kill any tapeworm larvae that may be present. 2. Hand hygiene. Wash your hands thoroughly with soap and water before and after handling food, using the bathroom, or coming into contact with animals. 3. Good sanitation practices. Practice good sanitation practices to prevent the spread of tapeworms from person to person or from animals to humans. 4. Avoiding raw or undercooked food. Avoid eating raw or undercooked meat, fish, or poultry, which can be a source of tapeworm infection. 5. Regular deworming of pets. Regularly deworming your pets, especially dogs and cats, can help reduce the risk of tapeworm infection. How various tapeworm infestations are treated. The treatment for tapeworm infections depends on the type of tapeworm and the severity of the infection. In general, most tapeworm infections are treated with prescription medication that is specifically designed to kill the tapeworm. Here are some common medications used to treat tapeworm infections. Praziquantel. This medication is effective against most types of tapeworms, including beef, pork, fish, and dog tapeworms. It works by causing the tapeworms to dissolve and break apart, which allows the body to eliminate them. Albendazole. This medication is effective against several types of tapeworms, including pork and dog tapeworms. It works by preventing the tapeworms from absorbing nutrients, which eventually causes them to die. Niclosamide. This medication is used to treat tapeworm infections caused by the fish tapeworm. It works by disrupting the tapeworm's ability to absorb glucose, which eventually causes the tapeworm to die. In some cases, surgery may be necessary to remove tapeworm cysts or other complications associated with the infection. However, surgery is typically reserved for more severe cases that do not respond to medication. What is the treatment for an invasive larval infection? The treatment for an invasive larval infection depends on the type of tapeworm and the severity of the infection. In general, the goal of treatment is to kill the tapeworm larvae and prevent further complications. For neurocysticercosis, the most common type of invasive larval infection, treatment may include a combination of medication and surgery. Medications such as albendazole and praziquantel can help kill the tapeworm larvae, while corticosteroids may be used to reduce inflammation and swelling in the brain. In some cases, surgery may be necessary to remove large cysts or relieve pressure on the brain. For other types of invasive larval infections, such as those caused by the hydatid tapeworm, treatment may also involve a combination of medication and surgery. Medications such as albendazole or mebendazole can help kill the tapeworm larvae, while surgery may be necessary to remove large cysts or repair damage to affected organs. It's important to note that treatment for invasive larval infections can be complex and may require close monitoring by a healthcare provider. In some cases, treatment may need to be continued for several months or even years to ensure that all of the tapeworm larvae are eliminated. Additionally, it's important to take steps to prevent reinfection, such as practicing good hygiene and sanitation practices, and avoiding consumption of undercooked or contaminated meat. How long will I have a tapeworm infection? The duration of a tapeworm infection can vary depending on the type of tapeworm and the severity of the infection. In some cases, a tapeworm infection may be asymptomatic and go unnoticed for months or even years. In other cases, symptoms may develop quickly and the infection may be treated relatively quickly. In general, intestinal tapeworm infections can be treated with medication, such as praziquantel or niclosamide, and symptoms may begin to improve within a few days. However, it's important to complete the full course of medication as prescribed by your healthcare provider to ensure that all of the tapeworms are eliminated. Invasive tapeworm infections, such as neurocysticercosis or hydatid disease, may require more complex treatment and a longer duration of treatment.